Hey guys, my name is Dr. Brett Boshin, and I'm a licensed practicing dentist. I wanted to create this channel as a way to help educate patients on topics surrounding our industry, as well as dispel or shed light on some myths or controversial topics. Today, for my first video, I wanted to start with a fun one that would hopefully spark some debate, and that is marijuana use before dental procedures. The reason I wanted to do this is because a lot of policy changes in America have made marijuana use a lot more prominent and has increased the amount of patients that show up to the office while on marijuana or as heavy marijuana users. That being said, the state that I work in, marijuana is illegal in all forms, even as a medicinal form. So patients are very averse to letting us know or telling us that they are in fact high or that they're regular users. And one of the biggest things I wanted to say to patients was, we're not the police. We're not going to tell the police. We're not going to tell your spouse or parents or whatever. We just want to know. We want to know what drugs you're on, what medications you're on, because all of this absolutely affects what we do and how we approach you as a patient. And everything comes in mind with safety first. So if you are a user of any type of drug, a lot of these can be extremely dangerous with some of the anesthetics or some of the medications that we use or may prescribe to you before or after your procedure. So please tell us. One of the major reasons for this is that weed is in fact a stimulant. It increases heart rate, it increases blood pressure, and it actually does increase anxiety, even though a lot of folks will use it as a way to hopefully reduce anxiety or take the stress off after a long day. A lot of reasons people use marijuana before the dental office is because they think it's going to have anxiety reducing effects and help them get through the procedure with less stress. Unfortunately, what we see is that it's the exact opposite, and that when put in acute anxiety situations, marijuana has more of a stimulant effect than it does an anxiolytic effect. And what occurs with this is that it reduces the efficacy of our local anesthetic, or what gets you numb, causing us to have to use more of it, have to give you more injections, so that's more needle shots. And a lot of research has shown that those patients still aren't getting numb, and we're having to use more and more. The reason this is dangerous is that there is epinephrine in our local anesthetic, and epinephrine is obviously a stimulant, and marijuana being a stimulant, these two things together, and the fact that we have to use more local than we would normally use, can be dangerous in some situations and can actually cause cardiovascular problems or even heart attacks. So what happens is that folks come in, they already don't like the dentist, and we totally understand that, and now they're on this stimulant that is potentiating all of these issues. And what that does is that causes us, like I said, to have to use more anesthetic, to have to give you more shots, which just makes everything worse. And then sometimes those shots don't even work because you're on marijuana. So then you feel what we're doing, which makes the whole thing even less enjoyable. And then you hate the dentist even more. And then you smoke more weed the next time you come in. And it's kind of this perpetuating cycle. Another thing users don't realize is that marijuana can be extremely dangerous when mixed with certain sedation drugs. So especially for users or young teens or people in their 20s, 30s that are getting their wisdom teeth removed, that are undergoing general anesthesia or IV sedation, they don't realize that marijuana can absolutely cause a lot of complications with these drugs. It will cause the surgeon to have to use a lot more of the drug in order to keep you sedated. And research has shown that marijuana users use a lot more opioids post-op. And what this tells us is that marijuana, and we're not sure how this works, or a lot of research is still being done on this, but marijuana usage before and after surgical procedures actually increases post-op pain. And this causes the user to request more opioids, which, as we know, opioids are a big issue, and we really want to reduce the amount that our patients need. So being acutely high going into a surgical procedure where certain medications are being used via IV, general sedation, all of that can be extremely dangerous and can actually have a very high risk of causing strokes, heart attacks, other things like that, or heart arrhythmias. Research also shows that patients that heavily use marijuana before these procedures that have undergone general anesthesia have greater increase of heart arrhythmias afterwards. So basically what I'm saying is that we want you to be open and honest with us. We want to help you as much as possible. What I'm trying to say is that, first thing, tell your dentist to be open and honest with them. We're not going to judge you. We just want to know, and we just want to do what's best for you and what is safest for you and for us and our staff as well. That is the number one goal with everything. Number two, marijuana has a lot of other effects on the oral environment as far as salivary production, salivary quality, all of this other stuff. And if we know that you're a regular user, we can guide you in certain ways to help you more. Like I said, we're not going to judge you. We're not going to think less of you, and absolutely not going to tell on you in any way, shape, or form. Our number one goal is your safety and your oral health. And the final point here that I want to make is, even though some things may seem a certain way, it turns out that they may not be that way. So please do your research, talk to your healthcare provider, let them know certain drugs that you're using, because they may or may not be dangerous while doing procedures. A big issue that we see in the dental field is most people come in and they ask us, well, why do I have to fill out this health history? Why do you need to know all this? We're just doing X, Y, Z. But people don't realize that our surgical procedures deal with bone healing, soft tissue healing, all kinds of medications that we use, like I said, epinephrine, lidocaine, septicaine, certain benzos, other things that we do that absolutely can have an effect and can have dangerous contraindications with medications that our patients are using. So with that, I'm going to end this first video, and if you guys liked what you saw and want to see more, please like and subscribe, and absolutely leave a comment below. I will try to respond to as many of them I can and be as informative and helpful as I can. Thank you so much for watching.